Have you ever wished you could erase some of the visible signs of aging, but maybe shied away from the idea of cosmetic surgery? Dr. Robert Langdon from the Langdon Center in Guilford has been performing minimal incision facelifts for more than 10 years now, and is here to tell us more about the Express Lift. Welcome back, Dr. Langdon.
Great to be here, Jocelyn.
Tell us more about this Express facelift.
Well, this is a procedure I've been refining for the last 10 years, and it's a real facelift. We do it with a short incision or minimal incision, so what you see on the surface is relatively minor. And the term express lift has to do with the relatively quick recovery, because we do the procedure with local anesthesia, which greatly reduces bruising and swelling. So people are looking very good within a few days.
What's the difference between a regular facelift and an express facelift?
The main difference would be the minimal incision, but the other important aspect is that we are doing a relatively extensive process beneath the surface. So the essence of a facelift is getting the fascia layer, which is a tough layer below the skin, to be able to move. And in order to do that, you have to loosen it, and that is done in a manner beneath the fascia, and it takes a special effort to loosen it in order to get it to move adequately.
A lot of women ask for this express facelift versus the other type?
Yeah, I think people are attracted by the quick recovery would be the biggest advantage. And also the minimal incision. We'll show a couple of photos in a minute that demonstrate that it's very hard even to see where that incision was made.
That's amazing. Now, how long is this procedure compared to the traditional one?
Well, it takes probably 3.5 to 4 hours to do. And a lot of people have heard about something called the lifestyle lift that is heavily marketed throughout the United States. And they say, oh, it takes about an hour to do this procedure. And it's just not possible to do a significant facelift. I actually see people who have had that procedure and have been very disappointed with the results. So you really have to do a more extensive procedure to get good results.
I can't even imagine an hour facelift.
Yeah, it's hard to grasp.
It is very difficult to grasp. Let's take a look at some of the pictures and see what we've been talking about here. And this is a woman who was looking to do what to her face?
This is a patient who had several years earlier had liposuction of the neck area. So if you look at her picture on the left, which is the pre-treatment photo, her neck actually looks pretty good as far as the profile. Most people actually, if they have never had liposuction in the neck, would have more volume, especially beneath the chin area. But we'll show a close-up of her also, and she does have significant sagging in the lower cheek area. Yeah, here we go. If you look from the corner of the nose down to the corner of the mouth and down to the jawline, there's a pretty deep furrow. And then just behind that furrow, just above the jawline, she has quite a significant jowl.
She has more of a definition in that after picture.
Right. So one of the problems in the before photo is that her jawline is not very well defined. Her jowl is actually hanging below the jawline.
That's true.
If you look at her neck, there are some horizontal or 45-degree angle lines just showing the looseness in the neck. And the real benefit of a facelift is helping not only the neck, but also the lower part of the face, the jowls, and even the area above the jowl on the cheek.
Well, we were talking earlier about the recovery. How soon will women see an effect?
They actually look very good within a few days.
Just a few days?
Yes, and there are stitches on the surface, even though there's a minimal skin incision. The stitches on the surface have to be there for a week, and most people look very good, you know, at the time the stitches come out. We've even had women who have had this procedure. The hair is long enough so that it is covering the stitches. They've actually gone back to work activities within 3 or 4 days.
And when do they see the full impact?
Well, they certainly see a lot of improvement, you know, within a few days, and there is some swelling that is part of the process, and that will go down That picture we saw a minute ago actually was just 3 weeks after the procedure.
And you're actually having a seminar tonight about all what you do at the Langdon Center.
That's right. We do seminars pretty much every month, and we do have one tonight. So if you want to learn more about this procedure, our emphasis in this particular seminar will be on facial procedures, but we will talk about all the other procedures we do, such as liposuction.
And the information is right there on the screen again. It is a free seminar.
Correct, yeah.
Very good. And of course, for more information, you can just come to our website, and we'll get you linked to your website as well. Dr. Langdon, it's always a pleasure to have you with us. Thank you so much.
Okay, thanks, Jocelyn.
You're welcome. Coming up next, we're learning how to master the fine art of cooking lamb cuit sous vide and liquid nitrogen ice cream. Don't miss this one.